My name is Monica Heltz, and I'm the Public Health Director for your Fishers Health Department. Today, I'm excited to announce the rollout of our community-wide COVID data for the City of Fishers. Previously, we were able to bring you a snapshot of our data based on our local Fishers Health Department testing site data. We will keep that data up and available for you to review as well, but our hope is that this newer dashboard will provide you with some additional information to inform your decisions going forward. I wanted to take this opportunity to navigate through the dashboard and findings with you. You may wonder where this data is coming from. This data is a collection of all positive results on Fishers residents coming from any laboratory and reported to the Indiana State Department of Health, or ISDH. This is different from what you can see on our Fishers Health Department testing site data because the individuals who have been tested there have generally been healthier than those who may have been tested at the other sites. There are many who get tested outside of our drive-in site, such as at urgent cares, outpatient labs, hospitals, and all of those people may still live in Fishers. This data is required to be reported to the ISDH. This data that we're presenting today reflects all cases that are in our community and gives you the biggest picture we have of the level of our community spread. Our Fishers Health Department testing site data is just one piece of this larger puzzle, which you see represented here. These data sets are not perfect, and you may see them fluctuate as the testing data come in from different labs at different rates. There are a couple of things I do want to highlight about our data. First, as you can see, in the positives by age group category, we continue to have positives in all age groups. Nobody is immune from the potential for contracting and spreading this virus. I would also mention that we have recently noticed an increase in positives in our younger age groups, particularly those in their late teens and early 20s, as seen on the national news. I would also like to highlight the bar graph at the bottom. What we see from this is that our highest number of positives thus far was in mid-April. You may notice that this average has increased since the low point in mid-June, which we are monitoring very closely along with other indicators, especially in light of the recent increases in many states nationwide. I want to be clear that there is no one tool that is going to provide us with the complete picture of where we are at in this pandemic. We gather data from a variety of sources to determine factors such as the national, state, and local context we are operating in. We will continue to base our recommendations to you off the best information we can gather so we can all move forward safely together. Let this be another small tool in your toolbox as well. I would continue to urge you all to continue your best practices of facial coverings, social distancing, hand washing, and limiting your exposure opportunities. Mounting evidence demonstrates the effectiveness of masks as a simple measure to control the spread of this virus. Please also continue to maintain distancing when socializing with friends and family and limit those interactions. Continue to use simple sanitation measures, such as increased hand washing and wiping down of surfaces, particularly when gathering with others outside of your household. Maintain an awareness of any symptoms you may have. Although people can spread the virus without symptoms, most people experience some symptoms, which may include fever, chills, shortness of breath, fatigue, muscle aches, a loss of taste or smell, headache, sore throat, congestion, nausea, vomiting, or diarrhea. If you're experiencing any of those symptoms, or if you have been notified that you have been exposed, or if you would just like to know your status, we would encourage you to register for free testing at our Fishers Recovery site. If you find out that you are positive or if you are having symptoms, please do your part by maintaining isolation as recommended. Please answer the phone when we call so we can do appropriate contact tracing and get ahead of this virus. If you find out that you've been in contact with someone who has COVID, please keep quarantined for the full 2 weeks. Although you may be lucky enough to not be seriously affected if you contract it, we know that there are many in our community who would not fare so well. We are all in this together, and the only way we can get through this is together. This is our chance to really shine as a community and to show that we know who we are as a city and that we are willing to do the right thing for our community. We know that as things continue to open back up and our daily interactions increase, we will continue to have exposures and even serious illness. Although we are opening the community, we know that this is not over and the virus continues to spread. I would encourage you all to be part of the solution going forward as we all do our part to decrease the spread of this virus. I hope this provides you with the information you need.